Good afternoon, everyone. I appreciate you all coming to this Health Command Center to get a briefing, latest information with regard to the outbreak of H1N1 slash swine flu. That is very much on the public's mind. Joining me here today is obviously Heather Howard, Commissioner of Health, her assistant, Commissioner Tang, who does the work with respect to all of the clinical evaluations, Director Conyas, Superintendent State Police Fuentes. We have a strong team working on this issue. We've been in constant contact with each other. Had a cabinet level meeting to this issue on Monday, but there were previous meetings and information exchanges with regard to the developments that we saw around the globe and here in the U.S. We do want to announce today that we have 5 confirmed cases of H1N1. Now in New Jersey, they were probable cases that were submitted to CDC, and we have 2 other cases under review at this point in time. I think all of us carry reasonable concern about this issue, but we're certainly not in the alarm stage. What we are in is the proactive surveillance and monitoring effort, one that we have planned for. As we stand here, on the other side of that wall is a tabletop review of what we started in 2006 with regard to preparing for an avian flu outbreak. And we established protocols. We're looking for how we can expand or apply those in the particular circumstances that we are operating under today. This team, led by the individuals that I cited, has done a terrific job, I think, of responding and making sure that the public is informed, and certainly that we're doing our homework. Before I came to this meeting, I had a conversation with Director of Homeland Security, Janet Napolitano, to get a posting on what's happening nationally. What you hear generally in the press is exactly what is occurring. She made the point to me in those conversations that we have to keep in mind that pandemic is about geography, not about severity with regard to the flu. Means that it has spread to various regions, and while the WHO has labeled that, that is not what we have done here in the United States. And again, even if it were to be a pandemic, that means region spread, not severity. And in fact, people ought to keep in mind, another comment that the director made is that seasonal flu, unfortunately, carries with it risks on a regular basis. As many as 36,000 Americans die from seasonal flu. My point being that severity is just as important a consideration as the scope with regard to these issues. And at this point, at least our own experience here in New Jersey and in the United States is fundamentally that this is a mild strain. It doesn't mean that it can't change and mute, but we feel like we're on a good track, feel very confident about the team's evaluation of these issues here in the state. If any of you saw President Obama last night, I thought he was very articulate about some very simple things that people are supposed to do, which I did right before I came in here. Wash your hands thoroughly and frequently, cover your cough, sneezes, and stay home from work if you have flu conditions. Then go ahead and have yourself tested, being in contact with your health care provider. These are just straightforward, simple, common sense responses that actually will do a lot towards holding back any spread that might occur with regard to this. And so we want the public to know that we're prepared. We have previously purchased in 2006 800,000 doses of this Tamiflu. 2 tablets a day. We're prepared to pass these out if we had some kind of broader epidemic situation. We've acquired 300,000 additional, if I'm not mistaken, Commissioner, and we are prepared if there is the need. So I just I want to remind people that that we have a great operation in place, and I do want to thank everybody for their absolute commitment to making sure that we're doing everything we can. You know, we now have a 1-888 number. You'll get the commissioner will give it to you. I'll invert numbers and then somebody will get it wrong. But we've practiced our flu drills. We think we are in a very good place to make sure that we're protecting the citizens, and the protocols are in place, and I feel good about where we go from here. So with that, I think I'll turn it over to the commissioner. I thank all of you, but it is time to be cautious but not alarmed.
Thank you, Governor. Let me just introduce 2 key members of my team. David Gruber, Senior Assistant Commissioner of Health Infrastructure Preparedness, and as Governor Corzine mentioned, Dr. Tina Tan, who is our state epidemiologist and is in constant contact with the Centers for Disease Control. As Governor Corzine said, New Jersey now has 5 residents with confirmed cases of H1N1 influenza, also known as swine flu. We received the results of this confirmatory testing this morning and wanted to get this information out as soon as possible. Here is what I can tell you about the individual cases. 3 cases are members of a Burlington County family. They are a 47-year-old male, a 14-year-old male, and a 10-year-old female. This family had traveled to Mexico recently. The 2 children did not attend school before becoming sick and have not returned to school. The other 2 cases are a 43-year-old Monmouth County female and a 22-year-old Bergen County female. One recently traveled to Mexico and the other to California. All 5 individuals had mild cases of H1N1 influenza. I'm pleased to report that none were hospitalized and all are recovering well at home. There are 2 other probable cases that the department has sent to the CDC, and we expect to hear hopefully by tomorrow about whether those are confirmed, and we'll of course keep you informed.
Governor, you want to take one of those pills?
It is important to note that the cases are scattered throughout the state, as I mentioned, which indicates that we do not have a cluster. Also, schools are not involved because, as I said earlier, the children did not attend school before getting sick and have not returned since. In watching what is happening throughout the country and in other countries, it is safe to say that we can expect to see more cases in the coming days. Our public health officials here continue to monitor how the disease is spreading so we can better understand the outbreak. We understand that people are concerned. That is a very natural reaction. To help ease those concerns, the department yesterday opened a 24-hour hotline, an information line for both the public and healthcare providers. That number is 1-866-321-9571. In just the first day of operations, we've received more than 1,100 phone calls. The situation here is one of concern, but not one of alarm. New Jersey residents should continue to go about their daily routines. Children should go to school, and people should go to work. Right before this conference, as Governor Corzine mentioned, I participated in the tabletop exercise with other key members who are here of our New Jersey response team. We are doing everything we can to respond to this outbreak. But I cannot emphasize enough the importance of practicing good hygiene and common sense practices to prevent illness. Washing hands thoroughly and frequently, covering your coughs and sneezes, and most importantly, stay home from work or school if you are sick. I urge all New Jersey residents to continue practicing these good habits to protect themselves and their families. Stay informed from reasonable sources. The department will continue to post information on our website to help our now stay safe and healthy. And again, to reiterate, our hotline number is 1-866-321-9571. And I'll now turn